I need to talk about dementia today. It's actually, dementia is kind of a category, a class of diseases. Vascular dementia is where you have the same causes of obstructive arteries in the coronary arteries of your heart, the arteries in your eyeball that give you glaucoma, and clogged arteries in your kidneys, which give you kidney failure. You get plugged arteries in your brain, you get vascular dementia. You don't have enough oxygen and food getting to the brain. And there's Korsakoff syndrome, which was first identified in the late 1700s, about 1772, by a Japanese naval surgeon and attributed to a deficiency of a single vitamin. Wernicke-Korsakoff is a deficiency of the same vitamin, Korsakoff syndrome, but it has, the Wernicke part is they have MS at the same time with it. And then there's B12 dementia, and then Alzheimer's disease. All of these dementias in modern times are caused by physician-caused dementias, particularly Alzheimer's disease and vascular dementia, and of course, even indirectly, Korsakoff syndrome, Wernicke-Korsakoff syndrome, and certainly B12 deficiency syndrome. I want you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Immortality, and the book Rare Earths Been Cures. And the reason I want you to get these 3 books, you're going to learn that you can actually prevent all these diseases. They are reversible. They're all nutritional deficiencies. Many of them have contributing factors such as inflammation, fried foods, processed meats, oils, and so forth. So prevention includes the 90 essential nutrients. I like the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. And then the Ultimate Daily Tablets, which are designed to support healthy blood flow through obstructed arteries. So if you have vascular dementia, this is a really an essential thing. If you have Korsakoff syndrome, Wernicke-Korsakoff syndrome, and the B12 deficiency syndrome, you need the added de-stress capsules, 3 of those twice a day per 100 pounds of body weight. And then Alzheimer's disease, certainly you need 6 to 12 eggs a day per 100 pounds of body weight. And Smart FX, which contains DHAs and EPAs, which are the raw materials for your neurons, the brain cells, to make neurotransmitters for memory, cognition, problem-solving, motor function, and so on. Well, I have to tell you that the FDA sent out a notice to doctors, an email, back in February 2012, said, get all of your patients who are on cholesterol-lowering drugs, statin drugs, get them off of these drugs because they increase their risk of type 2 diabetes by 52% and Alzheimer's disease by 100%. So I urge you to get them off. Well, 99% of physicians didn't do that because they make too much money by keeping you on it. And, of course, the side effects of the drug include Alzheimer's disease, low T, erectile dysfunction, menopausal symptoms, adrenal exhaustion, because all these hormones and brain functions rely on cholesterol. All the hormones, testosterone, estrogen, progesterone, and adrenal hormones, are 95% by weight cholesterol. You can't be eating a cholesterol-restricted diet and take cholesterol-lowering drugs and expect to avoid Alzheimer's disease, vascular dementia, Korsakoff syndrome, Wernicke-Korsakoff syndrome, and B12 deficiency syndrome. So I urge you to take the supplement program, get a hold of the books Epigenetics, The Death of the Genetic Theory of Disease Transmission, Immortality, shows you why the countries that are third world and are illiterate have 40 times 100-year-olds we do. They have 100 per 250 of the population, and we have 100 per 10,000. They don't have much in the way of dementias. It's a big part of our population now. 1 out of 3 people who die in nursing homes dies with dementia. Okay? Don't forget Rare Earths Been Cures. You'll just be amazed what we know about preventing and reversing dementias. Again, vascular dementia, Korsakoff syndrome, Wernicke-Korsakoff syndrome, B12 deficiency dementia, and Alzheimer's disease. Your doctor, probably the only one he knows about is Alzheimer's disease, and everything he knows about that is wrong. And I urge you to get a hold of that book, Epigenetics, and it will show you how terribly wrong the medical system went starting in 1901 when the American Heart Association got a $1.7 million grant from Procter & Gamble to endorse Crisco, getting away from the traditional fats that we use in our diet, butter, cream, eggs, and so forth. They said these polyunsaturated fats, hydrogenated oils, are much safer, and as a result, they created these diseases. And there was never any science involved in it. It just sounded good in the ad campaign, right? So this is something you're going to have to take control, because unless your doctor is one of those few who notify their patients through forwarding the email from the FDA or maybe even sent a postcard, guess what? Your doctor should be fired at the very least. Most doctors who created Alzheimer's disease in their patients really should be put in jail because they knew there was a problem. I told them in 1971. I actually published a paper in Acta Pathologica, an international comparative pathology journal, where I said clogged arteries is not due to cholesterol. It's due to inflammation, eating fried foods, processed meats, and so on. We have to be better than that. We have to kind of move ahead. We also have a new DVD out called Someone Should Go to Jail. Somebody needs to go to jail. And you want to get a hold of that new DVD from your associate, your young TV associate, and you'll just be amazed at all the good things that we can do. But we have to do it. We can't depend on the doctors for doing it. We can't depend on the government to do it. They have failed us. We gave them all the money in the world. We spend more money than all the countries in the world combined each year for health care. And what do we have? 1 out of 3 people dying in hospitals and nursing homes over the age of 65 die from complications of dementia. Obesity, we're obese because we followed their directions of exercising more and eating less. Hello. This is a crazy deal. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk about the brain, as I've got a Fox News story here that is headlined, "Keeping Brain Active May Delay Cognitive Decline by 9 Years," according to a study that was done by a Prasthani Vimuri, a radiologist at the Mayo Clinic. They say challenging the mind early with education and stimulating work, and later in life with reading, socialization, and computer use may help keep it thinking clearly into old age, according to this new research. A study of people in their 70s and 80s without dementia. Those with more years of education, mentally stimulating jobs, and greater amounts of cognitive activity in middle and later life started experiencing memory and thinking problems up to 9 years later than those with the least enriched lives. According to this radiologist, Mr. Vimuri says, "We knew that lifetime intellectual enrichment can delay the onset of cognitive decline, but here we were able to estimate how much it helps you." They say factors early in life, like education, employment, and mental stimulation later in life, were both very important. They say although education and employment seem to be more important overall, mid and later life cognitive activity accounted for at least a few of the extra sharp-witted years. To gauge this, the effect of exercising the mind regularly later in life, Murray and his team used questionnaires to assess how challenging the study participants' school and work had been, as well as how much they challenged their brains during middle and later years with activities like reading, socializing, and using the computer. Men and women with more education worked in mentally stimulating jobs. For example, a surgeon experienced mental decline about 5 years later than those with less education and manual jobs. This was all published in the Journal of American Medical Association's Neurology. They say, but it was encouraging how much later life activity seemed to make a difference for people who had less education and less stimulating jobs. Say regardless of education, they say that in work history, people who challenged their brains at least 3 times per week delayed the onset of cognitive decline by more than 3 years compared to those who did less. And I would contend those that probably take some supplements probably stave that off even further.
Oh, absolutely. There's no doubt about it, either unknowingly or knowingly. Again, people in third world countries who have 40 times 100-year-olds we do, these people are not cognitively impaired. They don't have a memory problem. They don't have dementia. And that's because the same things that make you live longer also protect your brain from free radical damage, from nutritional deficiencies. These people forget. And I would like to know the people who did this study, were they psychologists or who were they? Because they don't know a lot about biology, because the brain needs 90 essential nutrients just like the heart and the liver and the kidneys and the muscles and so forth. And the biggest single cause of dementia is nutritional deficiencies. And so we have to make sure that people get all 90 essential nutrients, and that's why for 68 years I've been constantly taking the 90 essential nutrients twice a day, and it hasn't failed me. Using the Chinese system, I turned 75. Using the American system, it would be 74 just a month or so ago. And it's one of those things where most people can't keep up with me cognitively, memory-wise, as well as physically. Most people think I'm in my 50s. I had one lady last night comment. We were having a meeting, and she says, "Come on, you can't be in your 70s. Look, you don't have any wrinkles in your skin. Your hair color is good. And you're very, very active, and you've been standing here for 3 hours." Most people, if they're 75 years old, they can't stand for 10 minutes, let alone 3 hours. And she said, "No, there's something wrong here." Well, that's because I've been taking the 90 essential nutrients twice a day for 68 years. Now, Doug, if everybody were like you and me, being obsessive about taking our supplements, the medical system would be real humble because patients only showing up once every 75 years. That won't work for them. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Orange County, California, and Lan, you're on with Dr. Wallach.
Lan, you're on the air.
Hello, Dr. Wallach. My name is Lan. My name is Lan Vu.
Okay, how can I help you?
I've been diabetic since early 90s, and I'm getting a lot of blood infection and kidney infection.
Okay, now, are you type 2 diabetes or type 1?
Type 2.
Okay, and let's see here. Are you on medication or trying to work on this on diet?
I'm on metformin.
Okay, are you on kidney dialysis yet?
No, I'm taking Diovan for kidney.
Okay, and how much do you weigh, Lanfu?
155.
All right, very good. Okay, well, there's two things we need to do here. Number one, we need to change your diet. And, of course, type 2 diabetes is a simple nutritional deficiency, a simple mineral deficiency. We've known that for 70 years. So we have a very, very good track record with dealing with type 2 diabetes.
Okay.
So diet-wise, I want you to give up all fried foods, nothing fried. It means no fried chicken, no fried fish, no fried potatoes, no stir-fried vegetables, no frying in any way, shape, or form. No fried eggs. It means nothing fried. Then
okay,
no processed meats with nitrates and nitrites. That means no deli slices, no sandwich meats, absolutely no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, that kind of stuff. Because the nitrates and nitrites in these processed meats actually cause inflammation of the cell walls, which aggravate diabetes, actually may contribute to the cause. If you're on statin drugs to lower your cholesterol, you must get off of them because they actually increase your risk of type 2 diabetes by 52%. And then absolutely no oils again, no olive oil, no coconut oil, no margarines, mayonnaise, sulfurs, and cooking oils. To eat canned fish is fine, but they're going to be packed in water, mustard, tomato sauce, not oil. Then from a supplement program at 155 pounds, I'd have you take 2 healthy blood sugar packs as your basic program. Is 1 per 100 pounds of body weight, and you're closer to 200 pounds than you are 100 pounds. And so I would take 2 healthy blood sugar packs per month. That will allow you to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangy Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Plus at breakfast and dinner, and then 4 of the Sweeties at breakfast and dinner. All would be accomplished by the 2 healthy blood sugar packs per month. And then because you have the kidney issues, I would also take 3 of the Ultimate Daily tablets twice a day, 1 bottle a month. Check your fasting blood sugar every morning before you medicate yourself because your blood sugar will drop drastically. So usually within weeks, you're either weaned off of your medication or significantly reduce it. Call me every 2 weeks, Lanfu. We'll be back after these messages.
Let's go to Buffalo, New York, and Bev, you're on with Dr. Wallach.
Bev, you're on the air.
Hi.
Hi.
I have a sister who has a diagnosis of DPAM.
I'm sorry, I missed that. She has a diagnosis of?
DPAM. It's diffuse peritoneal adenomyosinosis.
Okay.
It's benign masses in her abdomen, and it secretes mucus, and she has fluid buildup, and periodically she has to go in for paracentesis.
Okay, now how long ago was she diagnosed with this?
A year ago.
Okay. Now, I have to be honest with you. I'm not familiar with DPAM, okay, or DPAS, and so is this a malignancy or a benign process or what?
They call the masses benign.
Okay, very good. And that's what I was getting out of the deal, but I just want to make sure.
Okay.
And what are their predictions? What did the doctors tell her? Is this going to just sort of stay the same forever? Or is it going to be progressive? Are they going to have to do surgery? What are they talking about?
Well, a surgery was recommended, which was so severe we didn't think she would live through the surgery.
Mm-hmm.
So she opted not to do that.
Okay.
And so for the past year, she's been going in for taps when the abdomen gets so full, and they take out liters and liters of fluid.
Fluid, okay. And again, what does your sister weigh?
When After she has a tap, she weighs about 110 or 120.
Okay. And how old is she?
49.
Okay. Nobody else in your family has anything like that? No bowel problems like irritable bowel syndrome, inflammatory bowel disease, anything of that nature?
My mom had some bowel issues when she was young, but it's getting better. She's worked on her health through the years.
Okay, now, by working on her health, did she get on a gluten-free diet or eat more fiber, or how did she solve her problem?
She's eaten more fiber. She's taken supplements.
Mm-hmm. Okay. Well, now yourself, do you have any health problems, any asthma, bronchitis, bowel problems of any kind?
My brother has asthma.
Okay. Well, you all have a gluten intolerance is what the basic problem is here. And so what I would do is insist that your sister, your brother, yourself, your mom, your kids, anybody else's kids in the family, everybody needs to get on a gluten-free diet, no wheat, barley, rye, and oats. And I'll have to look up, and I'll maybe get Doug to look this up for me, this DPAS thing. And then, but I would get on a gluten-free diet. That would be first. No fried foods. Absolutely no fried foods of any kind. Absolutely no oils, no coconut oil, no olive oil, no margarine, mayonnaise, salad dressings, cooking oils, no gluten, no wheat, barley, rye, or oats. And then I would have her take the 90 essential nutrients, one healthy brain and heart pack, and get an extra bottle of selenium, have her take 3 of those twice a day, and then call me every couple of weeks, let me know how she's doing. We'll be back after these messages.
Let's head to the Bronx, and Mike, you're on with Dr. Wallach.
Well, Mike, you're on the air.
Hello, Doc. How's everything?
Fine, sir. Thank you. How can I help you?
Okay, well, on June 8th this year, 2014, my mother suffered a stroke. So we took her to the doctor, and they said they think that an AFib caused the stroke.
Mm-hmm.
So the problem is she can't swallow, so she has all this phlegm or secretions, and she can't get rid of it. So they put in a breathing tube.
Mm-hmm.
And then, so now, every time they take it out, every 2 days they got to put it back in because she just can't hold the secretions. So she's choking. Mm-hmm. So now they have the breathing tube, and they wanted to do a tracheostomy.
Mm-hmm.
And they want to put a peg tube in her belly because now they're feeding her through the nose.
Mm-hmm.
Nose through. So they're feeding her,
How much does your mom weigh?
She weighs about, now less, but she weighs about 120.
Okay, and is she in a care center or a hospice, or is she...
It's a hospital, yeah.
Okay, so she's still in the hospital.
Yeah, she's there. They're trying to, I don't know.
Yeah, okay. Did she have any health problems before the stroke? Did she have any diabetes?
Yes.
Or high blood pressure?
Yes, she definitely had diabetes. Yeah, diabetes, high blood pressure. She had weak heart, cardiomyopathy, I think. And so they gave her medicines, they gave her blood thinners, the whole nine.
Okay, well, they should be put in jail. Because how long have they been treating her for the cardiomyopathy?
Oh, since 5 years, 6 years.
5 years, okay. Now, cardiomyopathy is due to a deficiency of a single mineral, selenium. And if they'd have given her selenium, the cardiomyopathy would have gone away in just a couple of weeks. Diabetes is a deficiency of a single mineral. At 120 pounds, if they would have given her one healthy blood sugar pack and throw in an extra... in fact, because she has the high blood pressure and the cardiomyopathy and the diabetes, I'd give her, instead of the one healthy blood sugar pack, I'd give her one healthy brain and heart pack. I'd get her 2 bottles of Sweeties, have her take 3 or 4 of those twice a day, check her fasting blood sugar before she medicates herself every morning. And for the high blood pressure, I'd throw in the Ultimate Daily tablets, 3 of those twice a day, 1 bottle a month. And this program will support and promote healthy blood pressure, support and promote healthy blood flow through obstructed arteries. It will help her either significantly reduce or help her totally wean off her medication for diabetes. It should be an ex-diabetic. The cardiomyopathy, heart disease, should totally go away. Very, very quick time. Well, because she's had a stroke, she has obviously some residual problems. I would also give her what we call nightly essence. It's a blend of enzymes, one of which is called nattokinase. And nattokinase actually dissolves blood clots. Even they've been around there for a long time. Obviously, the longer they've been around, a lot of scar tissue in them, it takes longer to dissolve it. But this nattokinase in the nightly essence actually will dissolve blood clots. And I'd have her take 3 of those twice a day. If she can't swallow pills and tablets and capsules, the tablets can be ground up, the capsules can be opened up, and and the powder poured into a liquid. And meals, we have a meal replacer. If you make it with water, it's called the Slender Effects Weight Management System Meal Replacer. It's a protein drink. If you mix it with water, it's going to be a weight loss program. But if you mix it with heavy whipping cream and throw in, say, 4 eggs in each serving, blend it up really good, maybe even thin it out a little bit with some extra milk, and put it through those G-tubes, 2 servings a day. And then I really don't like the things that they use. They use things like Ensure and many of these sort of liquid meals that they have in cans. Read the label. They're 40 to 60% oil, which cause inflammation in the blood vessels in the brain. Certainly 180 degrees was from she should be getting. She should not be getting any oils. And so these meal replacers like Ensure are 40 to 60% oil, just opposite of what she should be doing. So that's very bad. So don't use those. Those are no-nos. Even though it's convenient for the nurse, it's fatal for the patient. So give me a call every couple of weeks. I want to know your mom's blood pressure. I want to know her blood sugar. I want to know her A1C hemoglobin. I want to know how her heart does, because she can get off, and this has to be done by the doctor, but she can get off her medication usually within weeks or months on this program, because she's going to get all the nutrients necessary to support maintenance repair of the heart, the cell walls in the diabetes thing, and also the blood pressure. Okay, Doug, let's go to callers.
Let's head to Maryland. And Andy, you're on with Dr. Wallach.
Hello, Andy, you're on the air.
Yes, how you doing, Dr. Wallach?
Fine, sir. How can I help you?
I have a question about antidepressants. Do you really think that somebody's body can heal from the damage done by antidepressants? My life has just been absolutely destroyed by these so-called happy pills. And
okay, now what? I'm sorry, I missed it. What's destroyed?
Antidepressants and antipsychotic drugs.
Okay, now is that messing up your life, messing up your lungs, is it messing up your brain? What's it messing up?
It's messed up everything. I'm on disability. I can't work because every time I go in public, I'm so paranoid, just so nervous.
Okay, now how much do you weigh, Andy?
I weigh actually 155, but I want to gain more weight, actually.
So you're 190 now?
No, I'm 155.
Okay. Now, how long have you been on antidepressant drugs?
I've been on antidepressant drugs for about 4 years, since I was 17.
Okay, so you're 21, 22 now?
Yes.
Okay.
21.
All right. And so here's what I would do. At 155 pounds, I'd get on 2 healthy brain and heart packs per month. As 1 full dose of the 6 products in each of those packs at breakfast, 1 full dose at dinner time. So those 2 healthy brain and heart packs are going to last you a month. If finances are difficulty, then do just 1 and get an extra bottle of selenium. So you can take 3 selenium twice a day. I want you to take, half of the calculated dose. I'm going to give it to you as if you're taking 2 healthy brain and heart packs. But if you can only do 1, just cut the 1 in half and give a half a dose twice a day. But if you're taking in 2, you're going to get 3 selenium at breakfast and dinner, 1 ounce of the Osteo FX Plus, our liquid mineral and calcium product, at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. All this will be accomplished by the 2 healthy brain and heart packs per month. Then I would throw in just the plain minerals. I'd get 2 quarts of plain minerals if you prefer the liquids, or you can get the capsules called mineral caps. That might be easier. Just take in 1 of the capsule of mineral caps at breakfast, 1 capsule at dinner time, and each cap equals 1 ounce of the liquid plant minerals. So that might be more convenient. Get 1 bottle, which would last you 2 months, 1 mineral cap at breakfast, 1 mineral cap at dinner, because I want you to get more of a mineral that's called lithium. And lithium was one of the first substances. It's actually an essential mineral. It helps your brain when people have depression, manic depression, bipolar disease, anxiety attacks, all this kind of stuff. And so I want you to have more lithium. You're going to get a lot of lithium in 2 of the healthy brain and heart packs, but you're also going to get more lithium when you add 1 capsule twice a day of the mineral caps. Then I would also throw in the de-stress capsules, 3 of those twice a day. It's 2 bottles a month. They're going to give you the raw materials for metabolism for your brain, so it actually functions better from a metabolism standpoint. And then I would throw in Smart FX, 3 of those twice a day. which is going to give you the raw materials to help cognition, problem solving, emotional stuff, and it's just a great program. None of the bad stuff, no fried foods, no processed meats, no oils, and no gluten. Call me every 2 weeks, Andy. We'll walk you through this. Do not cold turkey off your medication. Let the guy who prescribed the medication be the one to wean you off. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 95 Crusade. And Doug, let's go to callers.
Let's head to Pennsylvania. And Jim, you're on with Dr. Wallach.
Jim, you're on the air.
Hey, thank you. Thanks for taking my call, Dr.
Yes, sir.
Wallach. I saw you on Benny Hinn. I enjoyed you a lot. I got your book, DDDL, and I read it. I enjoyed it immensely. Now, I've spoke with one of your distributors, and this is what's prompted this call, because I've not been able to get you on the radio, so
Okay.
I just got you on the phone. The situation is, we talked over my situation. I have what naturally it's CHF, which is normal, and people, you can deal with that. But my CHF is what they call flash edema. I get no buildup. I get nothing in my arms, wrists, ankles, feet. No buildup. All of a sudden it comes 20 minutes. 20 minutes, I better be in the hospital.
Okay, is that because your chest fills up with fluid?
Well, yeah, I can't breathe. I can't breathe. I'm like my lungs are filling up with fluid. And
Okay, now, how much you weigh, Jim? How much you weigh?
I weigh 170.
Okay, do you have any other issues, any diabetes? Or?
I do have diabetes type 2.
Okay. And do you have any arthritis, anything like that?
No,
Okay.
not as of yet.
Okay, any history of skin problems, asthma, bronchitis as a kid?
Nope. None of that.
Did you have your appendix out when you were a kid?
No.
Okay, good. Okay, Shar, are you there?
Yeah.
Okay, this is, and Jim, I'm assuming CHF here, are you talking about chronic heart failure or talking about congestive heart failure?
Congestive heart failure.
Okay.
I had it 5 times in 1 year.
Okay. All right, Shar, congestive heart failure, edema fills up fluid in the lungs, type 2 diabetes. What would you do for a 170-pound guy?
Well, he needs the de-stress, and he needs if he's got diabetes, he needs the healthy blood sugar pack.
Okay, and let's see, what would you do for the de-stress, okay, that's for the congestive heart failure,
Yep.
and he needs a healthy blood sugar pack, so I'd give him 2 healthy blood sugar packs, as you say, Shar.
Yep.
Absolutely. 2 healthy blood sugar packs. That would be, let's see here, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 4 of the Sweeties twice a day. All that will be accomplished by the 2 healthy blood sugar packs per month. Also, Jim, you need to take your fasting blood sugar every morning before you medicate yourself, because your sugar will drop drastically, very drastically. Now, the de-stress capsules has the vitamin in it that's missing when you have congestive heart failure. Congestive heart failure is caused by a deficiency of a single vitamin, and when you eat sugar, it's going to aggravate it. That's why you have these flash edema attacks, because you've had sugar someplace. Either you have some juice, or you're drinking a beer, or you're getting some sugar somewhere, and that puts a lot of pressure on that system. If you don't have enough of that vitamin, you're going to get edema. And so Shar is exactly right. I'd go ahead and take 9 of these de-stress capsules a day, 3 at breakfast, 3 at lunch, 3 at dinner. Will be 3 bottles a month. That's going to give you several thousand times the minimum daily requirement of this one vitamin. Personally, I'd take 28,000 times the minimum daily requirement of this one vitamin each day, so I don't get congestive heart failure. And again, stay away from all the bad stuff. No sugar in your case. Okay, no juices, no fruit. Anything you can get from fruit, you can get from vegetables without the risk of the sugar. I'm going to stay away from fried foods, processed meats, and oils. And if you need some energy from an energy drink, I would use the Rebound. Go ahead and get the sticks. They're little pouches. Tear off the top, put it in a 12-ounce bottle of water after you sip a little bit out, and that will give you some great energy without the carbonation. And so wouldn't hurt also. Well, you're on medication for congestive heart failure, so I would just go with that. Shar hit the nail right on the head. Call me every couple of weeks. I want to know your blood pressure. I want to know your heart rate, your pulse, and I want to know your blood sugar and your A1C hemoglobin when you call me back, Jim. Okay. Doug, how much time we have?
About 2 seconds.
2 seconds. Well, I'm going to go ahead and take it, and I'm going to remind people, get my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. You will be amazed at all the diseases the doctors say are genetically transmitted, which are just simple nutritional deficiencies. Epigenetics, the death of the genetic theory of disease transmission. Thank you so much, Shar. Super job as usual. Thank you, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.